So may I request the next panelists and the keynote address speakers and the moderators to please come up on the dais. We are on to our next session, which is India-European Union collaboration in health sector, startup opportunities and challenges. May I request Mr. Rajiv Agarwal, Joint Secretary, Ministry of Commerce and Industry, Government of India, to join us on the dais. Is he around? No, he's not around. Okay, then Paul Lillrank, Professor, Aalto University, Finland. Please join us, Paul. Thank you. Sohini Mandal, Partner, NovoJuris Legal India. Please join us here. We have Jaanus Pikani, Chairman, Tartu Biotechnology Park, Estonia. Please join us. Kripa Gopalan, Assistant Vice President, Health, Intellecap Advisory Services Private Limited. Please join us. Ohrn, Investment Advisor, Business Region, Gothenburg, Sweden. Please join us. And Ankit, Bahl, Advisor Trade and Investment, Estonia Embassy, India. And also Molshree Pandey, Commercial Head, Life Sciences and Healthcare, Embassy of Denmark, India. Please take your seats. Thank you so much for joining us here today. It would be lovely to hear to all of you. Are we good? Yes, that's good. So we're talking about India and European Union collaboration in health sector today. The business world today is in a state of flux. New companies enter the ecosystem every day, bringing with them new technologies and business models, any one of which could transform an entire industry from the ground up. Most companies want to use this current of change to drive innovation. But the magic bullet is elusive as ever. The question is, how best to drive innovation? One way forward through these disruptive forces of changes is partnerships. Those partners could include universities, whose research expertise can be leveraged into game-changing research and diagnosis, accelerators that can source bleeding-edge innovations from all around the world, and agile startups that can experiment nimbly with new processes and ideas. For the last 2 years, InnovatioCuris has consolidated Indian healthcare stakeholders into an ecosystem to drive systematic change and worked with European Union member states like Sweden, Finland, Estonia, and Denmark to bring innovative companies to India. This effort of last 2 years has resulted in long-term cooperation agreements between India, that is InnovatioCuris, and Swecare, Swedish medtech from Sweden, Turku Science Park from Finland, Technopal and Tartu Biotechnology Park from Estonia, and Scanbalt Forum registered in Denmark, representing 11 countries in the Baltic Sea region. So now I leave it to the moderator to please take the session ahead. Thank you so much.
Thank you very much, and welcome everybody to this session number 8, where we talk about India and the European Union. As you can see, the European Union here is represented by its northeast corner, the best part of the world, through Estonia, Denmark, Sweden and Finland. And we also are representing different subject areas. I come from the academia, and Jaanus Pikani represents technology, particularly life science, and is based in Tartu in Estonia. Then we have 2 embassy people from Estonia and Denmark, and then we have a representative, Ohrn from Sweden, and she will talk about the regional aspect of these things. Then we have 2 expert areas here. We have Sohini Mandal, who she's talking about legal issues, and then we have Kripa Gopalan. She's representing capital investors and the consulting and advice business. So this is our crew today. I think I'm going to tell you a few things first. Then Jaanus will talk about science and technology, and then we go to the countries, and then we go to the specific subjects. So let me first tell you one vision, and then I'm going to tell you one story. Aalto University was founded in 2010 as a merger between a technology university, a business school, and art and design university. So the university leadership a couple of years ago decided that health and well-being is going to be one of our strategic focus areas. But then what? There are about 90 professors at our school who are in a way or another dealing with health and welfare related issues. In total there are 350 professors. So the question is how to get these guys to talk to each other and how to get the school's acts together so that we can represent ourselves to external bodies, to our friendly neighborhood university hospital in Helsinki, to the government and everybody else. So there was an organization, a coordination organization established, Aalto Health Platform, and I've been chairman of there since January. So this platform then combines the scientific areas that you can see there. While trying to get all these nerds and the business people and the architects and the artist designers to talk to each other, we have also tried to think about the vision. And I have a great vision, which would be to find a way how to get all these science areas, and then some, life science is not here, so we need to get them somewhere else, all possible science areas to work together for a common goal. I mean, as you know, all of you have done with scientific research, the curse of science is that most people study very narrow topics very deeply, from which follows fragmentation, and then it's left to the poor corporate people and entrepreneurs and perhaps governments to put together the pieces and create something meaningful. So what if we could do something meaningful from the start? So now, fortunately, this might be possible in the near future. The European Union, as you know, is funding research big time. The Union is using framework programs. Now the framework program called Horizon 2020 is ongoing. The next program is under design. Then we are talking about 300 or 400 million euros, so it's substantial money. But the talk in town is that the European Union would prefer to have what they call flagship issues and ask for research that would solve a problem from end to end. These problems could be then, for example, diseases, like there have been talk about Alzheimer's or stroke or diabetes. So imagine you would have a call and 100 billion euros on the table, and the union would ask you, design an end-to-end solution to this problem and involve everything there. So you have to throw everything you have on this problem, every aspect, starting from basic science to economics to service design to housing facilities, whatever. So, ladies and gentlemen, if this becomes reality, then I think there will be very, very exciting possibilities to think big. And when I say big, I mean something bigger than Europe and the European Union. And fortunately, the European Union also has traditionally had a lot of special programs for cooperating with India. So there will be, I hope, both the money and the administrative framework in place if we who do things can get our acts together and organize something big. So that was my vision. Then I'll tell you a story. It's a part of it is written in this book that I edited together with V.K. Singh a while ago. There is a chapter that I wrote here together with my student, Mr. Anssi Mikola, and it's about Aravind Eye Hospital. You all know Aravind. It's one of the two major Indian showcases when it comes to efficiency in health service production. The other one is Narayana Hyrdala in Bangalore. So Aravind Eye Clinic has developed the best system in the world for cataract surgery. They have done nothing magic. Everything that happens there follows the basic textbook of industrial engineering and management. So this my student, he was interested in doing a PhD on cataract surgery. And you have to know that cataract surgery in healthcare operations management is the banana fly. Namely, it's the kind of surgical procedure that is very common the actual procedure takes only a few minutes. It's highly standardized. So if you want to develop industrial efficiency in healthcare, you have to do it first in cataract surgery. If you cannot do it there, you cannot do it in anything that is more complicated. So that's why this is important and interesting. So Aravind has this system that's well reported in the literature. And then this my student went to Tamil Nadu to find out how the best eye hospital in the world works. He had previously collected data from Finland and the UK and noticed that the surgical team doing cataract in Finland typically produced 5 patients a day, while in UK they did 10. In Aravind Eye Clinic they did 100 before lunch, and the quality was top of the world. Okay, so Mr. Mikola was very excited. He came back and came to my office and told me, Paul, let's start an Aravind Eye Clinic in Finland. Let's do that. And then I said, yes, of course we do it. Then we did a little bit calculations on the back on an envelope, and we realized that, wait a minute, if we could have the Aravind system in Finland, we could cover the whole country, the whole market, with 3 surgeons. 3 surgeons. Currently there were about 350 people who make their living out of cataract surgery. So you can imagine, and they are organized, they are powerful, they are public employees, they are government. So the empire would strike back at us, so no chance. But then something interesting happened, namely the idea jumped to another sector. Like, you know, the viruses jump from pigs to human beings or birds to pigs and so on and so forth. So idea jumped to another sector, namely dental care. And in Finland, dental care is special because it's mostly private. So it's less regulated. There's less of the empire that could strike back. So we banded together with a couple of crazy dentists, and we established a company, Megaclinica Corporate Limited in Helsinki. And so this is an example of technology circulation. I think that's a key word. We don't want to talk about technology transfer anymore because it's only one way, and it's not that way the world works. Technology circulation means that you have 2 parties, in this case European countries and India, and then you have things sort of rotating between them, where every circle generates some new ideas, new contributions to the common goal. Okay, so without going into details, the Megaclinic business model was very much borrowed from Aravind, but we added a couple of new things that fit the Finnish context, namely wanted to be cheap, less than the public, but the problem with the cheap public dental care in Finland is that you have to wait for 3 months in order to get on the waiting list. So we could offer appointments within the next few days, and then this was a great innovation, could offer everything in one visit. So if you have several dental problems, you don't have to anymore fill your calendars with a dental appointment every Thursday afternoon. Rather, you sit there, if you can take it for 2 or 3 hours, and everything is fixed for you. So the production system can manage that. Okay, there are many other interesting innovations here that I'm not going to go into detail right now, but the point is here that looking at super efficient Indian charitable hospital that has built up its system over decades without knowing it. They have followed all the basic principles that you find in the industrial engineering management textbooks in the world. There's no magic, there's no wonder there. The only wonder is that why is not everybody doing it? Because it's all in the books. Every engineering students know them. Why don't they do it? Only these crazy guys in Tamil Nadu did it. You know. So that's, I think, is a great lesson here for us that when it comes to health service production, India today, in my view, is the most innovative place on the earth. It's simply because the conditions are right, while, say, the situation, as our lawyer friend will probably explain in a moment, the situation with importing and exporting medical devices and pharmaceuticals is very complicated, and there are regulations and stuff. When it comes to service production, the field is very much open. There are huge volumes, there's growing demand, there's tough competition. There are a lot of frugal solutions that you don't find in Europe. And last but not least, there's a variety of different business models that come up. Some of them are good, some are not so good, but they all are part of the evolutionary process that I believe and hope that will take the world further. Okay, so this was my story. Then let's move over to our panelists. I will first ask Jaanus Pikani to continue with this technology theme and tell us your story about life sciences in the Baltic region.
Thank you, Paul, and thank you for a fascinating story. It's not the first time for me to participate and be a presenter here at this meeting last year, InnoHEALTH conference. We had even bigger delegation from Scanbalt area. And couple of words about myself. I'm actually trained as a surgeon, cancer surgeon, but now 20 years has been deviated from this path to more to the management in healthcare and now business and entrepreneurship. I'm acting as a chairman of the Tartu Biotechnology Park, but maybe it's more important in this context that I'm also for the last 3 years been elected as a chairman of Scanbalt. As was mentioned, this is we call it a network of networks or meta-cluster of health and life science clusters around the Baltic Sea, which means that we have representatives clusters from at least one from each country around Baltic Sea. It means starting maybe if we take the northeast corner, St. Petersburg, Finland is represented by Turku, Sweden is Gothenburg, we have Denmark, have several clusters represented, North Germany, Mecklenburg-Vorpommern and Hamburg, we have Gdansk in Poland and Latvia, Lithuania and Estonia in the other part of Baltic Sea, so we close the ring. We have some associated members even further from Netherlands, Groningen cluster. And why this type of organization was founded, this was not imposed from top down, from the governments. It was actually initiative from the grassroots, from clusters 20 years ago. In these times there was great enthusiasm in genomics and biobanking, and this was like a first driving force. And since 2004, the organization is organized as a legal entity, non-profit entity under Danish law, and so we have a small office in Copenhagen, and it's only one paid employee, which is a Secretary General, has been a great and enthusiastic person. Why it was needed? So maybe it's contrary to India, this region has quite fragmented structure of small nations. Even Sweden, which is considered the biggest Baltic state, Baltic Sea state, has only 10 million population. And if looking to from outside, this doesn't look very attractive for the bigger nations, like if we speak about Japan or US or even UK, the big clusters. And if we combine this data and this strength, then we can see that this region can easily compete with the best examples globally. And also, if we look the leagues or sort of lists where we stand, then we see that in science and technology, well, the most indicators, most region in the Baltic Sea are quite top in innovation, in life science, in biotechnology, in genomics. Recent years, we have started to look outside our region, and I'm happy that we had in previous panel, we had Pavan here, who actually presented his story, and this was actually one project which was supported by European Union, and we were able to actually bring companies from our region to the different distant markets, and Pavan's project or idea was one of them, and now I was happy to hear that this has got a good response from India and has quite high expectations. So I'm happy to share these experiences and even more, but I see that it's time to give floor to next speakers as well.
Okay, thank you, Jaanus. So this gentleman knows everybody who is somebody in the Nordic region, so if you need to get in touch, then talk to him. He can find the right source. Okay, then let's move over to the embassy people. So we have Molshree Pandey from the Danish embassy. So please tell us a little bit about what the Danish companies are doing in India and what happens in Denmark.
Sure. Thank you very much for this opportunity. A quick introduction about myself. I'm Molshree Pandey, and I'm heading the commercial operations for life sciences in Danish embassy, and I'm taking care of the South Asia region. What we do in Danish embassy, typically what every embassy would be doing for their countries would be that bring in expertise from Denmark to India, and of course expertise that are required or expansion if it's required by Indian companies to Denmark. Now, how do we do that is very important to understand. We look at it in 2 or 3 different ways. One would be that, it's a very simple thing. Danish company would say, India is very attractive to us given the sheer volume and needs and requirements, so we would want to explore this market. So welcome, yes. We would do the need assessment for them, look at the market potential, tell them who are the right people to collaborate with, make their introduction and make it happen. The other way we do it is that when we pick up topics. So let's say in this year, I am working on non-communicable diseases. And I have looked at which are the areas within India is where we can collaborate, and looking at where the Danish policies are, Danish healthcare policies are, what would fit into the Indian environment and what would also meet the Danish healthcare industry requirement. Now, keeping that in mind, then we have identified which are the various states in which we could go and take these different companies to, or different stakeholders to. So this is another approach of doing it. Couple of ways in which we do it is, we do a lot of boot camps, we do road shows. So when we go to Denmark, I make a lot of presentations talking about the expertise India has after doing a lot of research here, and then of course make those presentations to various clusters like what Jaanus is talking about, right? So Bahl or BioPeople or Medicon Valley. So where there are a lot of these companies who would be interested in hearing about the potential and the need gaps in the country. And then, yes, create a boot camp of sorts in India so that they can really experience this Indian market. And we bring these companies here for about 1 week to 15 days. And it's a total immersion process for them where they, right from understanding the landscape, right from understanding how the healthcare infrastructure looks like, because it's very different from how it looks like in Europe. So maybe a product has been developed for a European market, may not meet the needs and the standards of the Indian market. So if there is a need to make a small modification to the product, what would that be? So it's a complete immersion process. You would also we would also give an understanding of the cultural environment, because how should you do the business here in this country? That's very important. When you shake hands, a yes does it really mean a yes? Or when people are shaking heads, you know, is there something that you should be thinking about before really signing on the dotted line? This aspect. Then, of course, there's a lot of, because it's startups also that we bring to India, then is there an investor community which could be interested in looking at their products? So we also make them meet a lot of investors in the country, get them the real-time feedback from the doctors and the key opinion leaders, people, those who've spent several years. So something as simple as in Denmark, people, you know, are very happy looking at digital readings. In India, people would need a printout of their report, otherwise they will not pay 1,000 rupees or 500 rupees. So, you know, these are very small nitty-gritties that companies need to understand, and which is what we expose them to and help them understand. Once this is done, of course, make the deal happen, help them set up legal entities, help them set up the processes, get custom clearance. So it's a whole lot of process, right from, you know, thinking about where this technology could fit into and how it would fit into and how do you establish yourself in the country. So that is what, at least from the Danish embassy side, we work on. If I can take one more minute here. So you know, if I talk specifically about how long have we been in India, I mean Danish presence, so it goes back to 16th century. And that is when the first, you know, this place called Trankabad in Tamil Nadu, this was, you know, the port which was established by Danish authorities to do some business in India. And it is since then that some sort of transactions or exchange of knowledge in terms of business and education has been happening. Some of the largest organizations that are working presently in India, NovoJuris, we are supporting them in a lot of different programs. Recently, we tied up with Goa government, and Danish embassy supported it, so which is like Danish government supported this program, where with NovoJuris Education Foundation, we have you know, picked up this project where we're going to train about 750 doctors and technicians in the state as to how do you deal with diabetes. And you know, it's not only patients, it's about the technicians, it's about the families. How do you really take care of the entire ecosystem? So that is one big project that we've taken care of right now. We are exploring more with NovoJuris right now, if we could, you know, partner with cities and do something here. Then there is companies like Coloplast, Falk, and I mean, the list is endless. So it's an interesting way in which we collaborate, and I hope we continue to do that. And yeah, that's what we do.
Okay, thank you so very much. So people, please consider doing technology transfer with Denmark. Okay, let's then move on to Estonia. So, Mr. Ankit Bahl, please tell the audience, why should anybody in India with 1.2 billion people be interested in Estonia with 1.2 million people?
Well, firstly, I think the panel deserves a round of applause just for the women participation. I mean, can we get some good applause? So thank you very much for having me here. This is the second year of participation for Estonia as well for the InnoHEALTH conference. I'm very happy to share with you, as my colleague here, Molshree, mentions, that we do a lot of hand-holding support for Estonian companies as well as for Indian companies who want to look at partnerships. Like you know, Paul mentioned that Estonia is a very small country, only 1.3 million people. And together with India, we make almost 1/6 of the world's population, right? But having said that, Estonia is actually very synonymously known as e-Estonia. The reason being that there is a very strong IT focus, and the backbone of the country actually is to be able to deliver services online. So there is the joke in Estonia where it says that there's only 3 things that one cannot do online. The one is to actually get married, the second is to get divorced, and the third is to trade property. For everything else, you can use government online services. And that's something that, you know, like Estonia is very, very proud about. The evolution of healthcare is also very, very important because connected healthcare is something that Estonia has been making a lot of leapfrogs in. Today, I'm happy to report that the connected health cluster that we have in Estonia has almost 66 companies, all from providing solutions for operating room IT solutions, smart healing beds, with Smart Do, which were also represented last year. And also, there is a lot of emphasis on being able to deliver mental health solutions with Documental, which I think Dr. Jaanus would also be happy to share more about. So I think there is a very strong emphasis on, being able to deliver IT solutions to be able to be connected. As recently as 2 days ago, actually, we had the ex-CIO of Estonia talking about how the government of Estonia is actually using data, which it is getting from public health records, to actually predict whether, for example, there is a very strong, focus on, for example, abortion, right? Women like to hide about this information, but in Estonia, you can choose. You can choose to talk about it, or you can choose to hide your data. And with statistics, you can, with today's day and age, the technologies that are available, you can actually predict in Estonia what would be the healthcare trends and how the government should be spending. So these are things that we have been able to develop, and I think there is a lot of focus on R&D. There is also the first one of the first countries to actually develop a biobank. And that's something that is open to commercial use as well, for being able to use predictive medicine and personalized medicine as well. And being a potential partner for investments, I also wanted to share about the investment regions that are available. And there are special economic zones which are dedicated for pharma companies and also for manufacturers of some of the diagnostic companies which are present in the audience today. And there are very, very exciting solutions in terms of good quality talent pool, good quality, services, health records, everything that is required. And you can actually start operations from day one. And we've seen a lot of good work coming through. I've been, last year, we had a very interesting company acquiring a cancer research center in Estonia. So we've actually managed to convince a lot of quality healthcare companies to choose Estonia. And I think a lot of top healthcare companies will see, the light of day from India in Estonia, and I'm quite confident about that, and that's why I'm here. Lastly, I would like to also share that today, 97% of the prescriptions that are made in Estonia are made online. So that is something that the government has achieved, and that's basically says that anybody who gets sick in Estonia would actually be able to get your prescriptions and get your medication from any pharmacy. And the cooperation has actually reached a certain level where we can actually go to Finland and actually get prescriptions from there. So if we in India can work with local state governments and with local partners, who are healthcare, who have multiple state operations, I don't see a reason why we cannot deliver such sort of solutions where even if you lose your prescription or lose your health records, everything can be at least accessible. And we also have a concept of e-ambulances, which is also something which is one of the first countries in the world to do that. So everything is connected, and we are very, very keen to partner with India and join the revolution with the digital healthcare in India.
Okay, thank you very much. So, to all you Indians in this huge country with 1.2 billion people, when you listen to Estonia, consider that there are certain benefits in being small as a nation, as a state, as a country. You can do things that are not possible to do in a big place, but we also have to consider that there are some things that you can do only in a big place and not in a small place. So again, one more reason for more technology circulations. getting engaged in many levels. All right, then let's move to Sweden. It is Ohrn. You are representing a region in western Sweden, the second biggest city in Sweden, Gothenburg. And so I expect you to tell something about what you guys are doing there, other than building Volvo cars.
Yeah, exactly.
And also, if you could say a couple of words to the audience about the regions, because in India I have states. In many parts of Europe, we don't have sort of states within states, but we have regions that sometimes are cross-border regions, like say Gothenburg bands together with Copenhagen, Malmö, so that becomes a natural economic region, and Helsinki, Tallinn is on its way to become a region. And many of these regions are conscious about themselves, they are organized, they put a lot of money to promoting economic activities, and many of them have an office in Brussels for lobbying purposes. So the region in Gothenburg, what are you doing?
So, hello everybody, good afternoon I think, nearly 12. So I will shortly first talk about me. I don't look very Swedish. So I am actually, I was born in Cuba, Havana, and then I moved, so I've been in Sweden now for nearly 20 years. So that's my background. I am a biochemist, and then I have a PhD from Cuba and an MBA from Spain. So I've been traveling a lot. So right now, I am working as an investment advisor for life science at Business Union Gothenburg. And Business Union Gothenburg, it's a company owned by the city, which is kind of very common in Sweden. And my work, saying it shortly, is actually to connect foreign companies to innovative companies from West Sweden in the area of healthcare and life sciences. So I am some kind of a matchmaker. As we have said before, Sweden is also a very small country. We are only 10 million people. So I would try to share here mainly the insights of our work. So we have actually a lot of innovations coming from Sweden, from the Nordics, and from Europe. Usually our companies, our researchers, when they think about collaboration and business of natural causes, they think about the Nordics, Europe, then they think about USA, Germany, perhaps then China, Korea, Japan, and India, okay? The challenge with India, I think, even though we have many things in common within the area of healthcare and life sciences, because we are a small country and our companies are relatively small, which means that some of the Swedish companies coming here might have 15, 20 employees, apart from the one that are kind of large, like Estonian. So it's difficult as a small company from Sweden to approach the huge Indian market. So they usually need partnership with local players. So it's not only about selling products to the healthcare, they actually need to have somebody here, either from a company in India or from an investor from the area, okay? So that's one. The other thing is that price. It's very difficult to, when we talk about market access, usually I think India is very good in providing healthcare at a lower cost. Of course, you can be better, okay? But when we come with Swedish products, European products to India, there is a challenge in trying to, reduce the price of those products, and then usually you might need to have some kind of production site here. And in that case, you also need a partner or the help from the embassy and, all trade and invest partners that are here. So my job usually it's mainly about trying to identify companies here, investors here, researchers, people that are willing and open to so collaborate with Sweden, and in this case I'm mainly working for so Gothenburg. I believe very much in relationships. I think that it's very difficult to do business, to do a partnership if people don't meet. So we are now trying, I think the last year and this year, we are actually trying to get more people to come to India, and then hopefully Indian people, which I mean might think that the Nordics are very small, we might be 26 million people, but perhaps many of you will consider, also working with us. Just one last thing which I think is important, it is that Sweden has a collaboration with India since many years ago in the area of infection control, maternity care, and diabetes, I think. We have been, from my experience, it has been a lot of focus on how we can help India, capacity building. What I have seen here today is that there are a lot of things that we can learn from India, because we have the same challenges as you have. We also have, rising health costs. We have an elderly population. I think within 25, 30 years, most of the people will be over 65, which is not the same here in India. But we are actually looking for new solutions to lower costs, and it might be more focused on delivering new services, delivering new ways of doing things. So I think my goal by being here is to try to meet people and try to discuss things more related to business models. How can we find a solution to work together? Because we want to work together, but there are some challenges. Yeah? So by me.
Okay, thank you. So now, ladies and gentlemen, you have heard the countries and the regions making their pitch. Why you should talk to them. All right, let's then move to some subject matters. The first would be capital and advice. And we have here Madam Kripa Gopalan. She is Assistant Vice President of Health at Intellecap Advisory Services. So she deals with money and with wisdom. These investment banker fellows are usually very smart because when somebody invests his or her own money, that forces you to think clearly. So there's a lot of clear thinking moving around all these investment banks and other companies. So please tell us a little bit what you do and what you think is important.
Thank you so much. A very good afternoon to everybody. I'm here to represent Intellecap Advisory Services. It's a part of the Intellecap Avishkar group. We are a group of companies of 5 wings, and we represent and we aim at actually creating a sustainable environment and an ecosystem for the underprivileged. So while we do have the social development as our main motto, we do look at opportunities that are viable for profit, but that technically lead to social change. So we are looking at every opportunity that have direct and indirect social development and change opportunities. And these can be businesses, these can be innovations, these can be entrepreneurs, this can be inbound and outbound technology exchange. There's a lot of opportunity. Every time there is a challenge, I think India sees an opportunity. That's actually where we are. Setting the context to why I feel this is very important to this particular panel is that we see India as a big corridor and the entire field for opportunities to be worked upon. And whether this is between technology, AI, wearables, devices, healthcare, not healthcare, there is a lot of field to play in. The largest strength that we bring to the table is our denominator. We are population, and well, there is variety in that population. So every time we look at maybe a particular challenge, a particular requirement, we do have a particular section of the population which can actually give a solution, represent, and thus be very fruitful to the entire collaborations that we're looking at. And where we do see Intellecap coming in and the entire group coming in, per se, the Intellecap Avishkar group, is that we see business solutions that are viable, that are sustainable, and they make a change. That's exactly why we are very stringent about whom we invest in and why we invest in. To just cite a few examples, we have invested in healthcare. Let me be specific with healthcare, is that we have a few groups like the Vatsalya Healthcare, and then we do have other important investments. But why Vatsalya is because we have a big focus on primary healthcare. That is one of the biggest leading requirements in any developing country. Primary healthcare is very difficult to deal with, especially because we expect the government to provide. But can primary healthcare be given in a subsidized way, in a low-cost way by the private sector? Yes. So Vatsalya is such a solution where you have even services being provided as low as 100, 200 or even 300 rupees, where the private sector will be charging in a tripled numerical representations in thousands of rupees in Indian currency. So we do have some areas in the group which we focus on as India specific. We have NCDs as a focus area group. We have tuberculosis as a focus area group. And we do look at low diagnostic services. And that includes innovations, entrepreneurs, and business models that actually can come back to less than $1 of screening services, maybe for an NCD. And that's where we come from. Now coming back to why and how, what kind of services and what kind of investment capitals that we look in. A quick number would be that we actually look at 1 in 100 a successful screening to a conversion of an investment. And why we are so stringent is because we want that change to happen. We want our frameworks that we look at to make that change in society. And we believe that this is a domino effect. It is not necessarily a particular investment making a particular change. There can be an A leading to a B, leading to a C that ultimately should and can come down to healthcare also. We look at the holistic approach to the segment rather than just health, agriculture, or sustainable livelihoods. We also have Sankalp as a forum. That's one of our biggest platforms that we put together. The group works with networks, it works with knowledge, and it works with capital. These are our three main forte arms. And network is what Sankalp represents. It is a forum where we bring together all the innovators, the investors, and the opportunities, and obviously the stalwarts of people who have achieved something in this sector. Sankalp is being held this year in December in Mumbai. All of you all are invited. Please do visit the website and search, do log in and register if you all want to. Most invited. And we do look at this particular forum where we also have collaborations with many, many organizations or embassies too, where we can showcase what India brings. So this is the ideal platform where people who want to understand the Indian market, to look at what opportunities exist, and what exactly do the current set of scenarios exist. You want to know what kind of investors are there in India? Well, Sankalp will have quite a few of them there. You want to look at what kind of opportunities that we can take back there? Then there is a simulation there. So this is just the ecosystem that we're going to bring together and represent what India has as opportunities to explore.
Right. Thank you very much. As you know, any businessman needs two external advisors, the banker and the lawyer. So now, finally, we will have the lawyer here. Madam Sohini Mandal is a partner at NovoJuris Legal in India. And you are familiar with the legal issues that are associated with technology transfer. So please tell us your story.
Thanks, Paul. Good afternoon, everyone. A quick introduction about myself. So I'm from NovoJuris Legal, which is a full-service law firm. We are based out of Bangalore and Mumbai, and I specialize in private equity investments, M&Es, cross-border M&Es, and of course, healthcare. So we have been associated with InnoHEALTH, InnovatioCuris for the last couple of years, and we have been advising companies on the legalities of entering India, the things to be legal concerns and legal things to be aware of while entering India. So I'm going to speak very, very briefly on some of the most important points to be conscious of. When we talk about entry modes into India, it is very dependent on the product, the service, and the exact stage at which each of the companies are into. For example, thanks to Molshree, Ankit, and Iris for setting the context on how the embassies are working to bring these companies into India. And you would also be aware that most of these companies would first want to scout the Indian market, right? To see if there are partnership opportunities, to see if the market is sound and safe enough to be, getting into IP transfers, IP exchanges, as Paul mentioned. And also a huge concern would be data privacy, data exchanges, data security. Now, depending on how ready these companies are, there could be two modes of entry into India. One is a very high touch and one is a low touch. The high touch would be where you kind of get into India and incorporate an entity in India. It could be a company or an LLP, and the advantage there is the liabilities are kind of restricted to the company, and most often it doesn't flow back to the ultimate shareholders. So that's the high touch. It also, one of the high touch modes would also be to do JVs, right? And joint ventures could be either contractual or, again, it could be an incorporated form, depending on the kind of presence a company would want in India. There could be a requirement of control, there could be a requirement of voting rights, or it could just be to scope the market to see what are the marketing opportunities, what are the distributorship opportunities. So if it is a JV-like structure, then it gives a lot of control, it gives a lot of, it ensures that you can bring in the right amount of investments to capture the market in a holistic way. The flip side of that is you're also very, very invested into the structure from the very beginning itself. So one of the low touches would be to just get into contractual tie-ups with partners, which is where the embassies kind of help in identifying the right partners and getting into distributorship, initial marketing, and identification of the market itself. Right? So these are the various entry points that could be evaluated, and I'm speaking at a very, very high level because of the paucity of time. Depending on the entry mode that you select, the concerns that need to be taken care of and the challenges that we most often see companies ask would be firstly IP. IP is a major concern when it comes to technology transfers and getting into partnerships, because the companies are trusting on the Indian partners and doing a technology transfer or an intellectual property transfer. And many a times, if it is a build-operate model where your product is such that it requires a lot of groundwork to set it up and groundwork to see how it works, a lot of annual maintenance, etc., then there is a lot of trust factor that comes in. In terms of pharma and medical devices, we earlier used to have only process patent in India, but thanks to the 2005 amendment, now we have both product and process patents, which gives a little bit of comfort, which is a good thing about the Indian legal system right now, that there is no reverse engineering was very, very prevalent in India, but now Ankit is smiling. So because thanks to product patent, you can actually patent your product as well, and reverse engineering is difficult. The other main concern today is data exchange and data privacy, mostly because European Union has moved to the GDPR regime, which is a very, very stringent data security regime, and there are very, very positive changes that we are seeing because of GDPR. India is also slowly trying to move towards a regime which is similar to GDPR. So we have the Personal Data Protection Bill which has come out, and it has heavy drawn influences from the GDPR. GDPR is the General Data Protection Regulation in the European Union now. which became effective from May 2018. Particularly, very recently, the Supreme Court has looked into the Aadhaar judgment and has passed a landmark judgment in Aadhaar case, which is also pushing the legislatures to think very seriously about personal data protection bill. Especially in healthcare, we have a Digital Information Security in Healthcare Act, which is DISHA, and it is still in a draft form, but we are very positive about it becoming an act very soon. What it does is that it talks about three very important things in healthcare. One is setting up central and state government bodies, NEHA and SEHA, which will have the primary role of seeing into data exchanges, setting up health information exchanges, and also passing protocols for how to do data collection, data storage, data transmission in a highly regulated sector of healthcare where each and every person who is interacting with a patient, right, you're getting exposed to so much sensitive personal information, and how do you make sure that it is collected and stored and transmitted for further use in a way that does not compromise the privacy of the individual patients. So this act is being seen as a very important step towards marrying the various ideas of governments need to have certain information, ensuring that there is trust in the system for patients to disclose their data. Patients are being, the people who give the data are being now recognized as data owners, which means they have complete supremacy of what can be done with that data, who all can that data be shared with. We are also seeing a recognition of the patient's right to rectify the data at any point of time. For example, most of you are medical professionals here, and you would know that medical data can change from time to time, right? So a patient's right to rectify that data at any point of time is also becoming important. What we are not seeing yet is the GDPR has recognized the concept of a right to forget or right to erase, which is not there in DISHA yet, but it's still a bill, and we are putting together our comments on the bill. One of the advantages of DISHA is also that it recognizes the threat of data breach, and it categorizes data breach into normal breach and serious breach, and puts serious compensation penalties, etc., to whoever is breaching that. So privacy, in terms of privacy, India is really pushing forward to be at par with GDPR, with the European Union, and that is another advantage for European startups, European companies to get into India. Apart from that, I would like to briefly touch upon some of the governance schemes that are coming up. So the government is looking into healthcare very deeply, as most of you would be aware. So we have now clusters of medical device parks, clusters of bulk drug industries, and the government is actively trying to provide grant-in aids. The state implementation agencies are providing grant-in aids up to an extent of 200 crores for setting up state-of-the-art laboratories, testing facilities, effluent treatment plants, and all of this is actually pushing towards making healthcare one of the predominant sectors of Make in India. So, which is where bringing European companies to India to share their innovation and gain from our experience, our population base becomes important. Thank you.
Okay, thank you very much, and thank you to every panelist for your crisp presentations and comments. Now, people, the major cultural difference between India and Northern Europe is our approach to time and time schedules. So I'm painfully, in my stomach, painfully aware of the fact that we are running 38 minutes and 25 seconds behind the schedule, even though in my head I know that this paper is not meant to be followed. But anyway, we're also standing between you and your lunch. So unless anybody of you is exploding with the will to comment on somebody else, I think we start to close now.
I think I just want to basically just to add to what Ms. Mandal was mentioning. In fact, there is a lot of interest, and I'm a very strong advocate of the GDPR. And I fully agree that, like one should have this choice to whether your data can be used. And I think the very good market that will open up is that, people will now be able to actually sell your data to, one of the big, healthcare companies. And I think that's the next future. So I think that's something which, you very nicely elaborated on GDPR. And I don't know how India will actually be working on this. Lastly, I just wanted to share that, the idea of innovation is very important, and we've been also working with the European Union. In fact, next week we also have Ms. Signe Razzo, who is the Deputy General, of Research and Innovation at the EU. And she is actually going to be coming to India to actually promote innovation in research, and especially focused on startups. So for those of you who would be interested, please feel free. And I think that would be a great platform for what you shared about these lovely initiatives that your company has been taking as well. So absolutely, thank you.
Just a small point to add on to what Ankit said. One of the idea of Disha is to, of course, build trust into the system so that patients are not fearful of sharing their data. And the other idea is that it should help a seamless exchange of information across the country. And we are a huge country, right? So implementation will, of course, be a challenge. But the idea is to have centralized or state-based centers where data could be accessed very easily, and that would also help us in identifying situations of an epidemic or a bioterrorism situation. So yeah, this is becoming very, very important now.
I have one final comment. Molshree here.
Okay.
And this is to Iris's point, where you were saying that most of the time European companies are struggling with the fact that they're very expensive and they don't find the market. Based on whatever research and my analysis and interaction with companies have been till now, there are 3 essential points, and this is how I probably scout for opportunities in Denmark for India. One is that whether the product has the capability to de-skill. Because a lot of times the doctors don't have the time, and it is the technician, or let's say an ASHA worker, or someone like that who would be using the product. So a simple device, because people these days in India are using mobile phones like anything, right? So everyone knows how to operate a smartphone. So can you come up with the product, or can Sweden or Denmark or any of these European companies come up with a product which can de-skill or has that capacity? Second is can it reduce the doctor's time? The doctors don't have the time here to sort of, look at every patient and look at the device and look at the report. So how is it that the device will reduce the doctor's time? So can it bust the queue that you have? So instead of going to for angioplasty, can you do something which can clearly distinguish that, this patient might need, this may not need, and can we do that distinction? And third is, of course, quality. And it may sound a bit contradictory, but what I'm trying to say is that quality, a lot of Chinese products are there in the market, and doctors, distributors, physicians, technicians, everyone is kind of also irritated by the fact that you invest a certain amount of money in it, and it just doesn't last. So these are 3 things I think which, if we keep in mind, European products will find market in the
Short.
No, sorry. We are going to close now, but thank you very much. So you can sum it up by saying that, technology circulation is not a piece of cake, not even Danish butter cookie. Okay, so I think we close now, and thank you very much to the panel. If you have questions, I suggest you talk with, we are all going to hang around lunch and later. So thank you very much for listening and your attention. And please do technology circulation with all of us.
Thank you so much, Paul, for really taking this forward from here. I think it's wonderful to learn from your experiences, how you've kind of overcome your challenges and shortcomings, and I think it would be a learning for all of us as well over here in India. May I request Paul to please hand over a token of love and appreciation to all our panelists who are sitting here. Please can we get the mementos? So could we start with Sohini Mandal? Thank you so much for joining us today. Jaanus Pikani. Thank you so much. Paul, would you mind standing here so that we can get good pictures as well? Thank you so much. To Kripa Gopalan, thank you so much for joining us today. To Iris Ohrn, thank you for being here. Ankit Bahl, thank you from being from Estonia, right? Is that how you do it? And then Molshree Pandey. Thank you so much. May I request Jaanus Pikani to please give us small token to Paul as well. We like doing this vice versa thing actually. Thank you so much. Thank you for joining us. Thank you so much.